Okay, we're recording live.
Hello, everybody. Thank you so much for stopping by. Our guest today is the medical director of Sacramento's Emergency Medical Service Agency with decades of disaster response experience. Guys, if you like what we do, please like and subscribe. Without further ado, please welcome Hernando Garzon, MD. Thank you so much for being on the show today, man. Thank you so much. How are you doing today?
I'm good. I'm good. Thank you both. It's a pleasure to be here.
No, it's really nice to have you on there, Hernando, because I know we have a mutual friend, Chip Duncan, that we've done. All of us, all of
Correct.
us are very fortunate to know Chip and have done multiple journeys around the globe with Chip. So actually, I'll probably talk about that a little bit later, because there's a lot of really cool kind of synchronicity and things here. But what we do first is we do something called two truths or several truths and a lie. And Devin and I have to pick which is the lie about you. You've sent us some points, and we have to guess which is the lie.
I
So
love it.
Dev, yeah. So Dev, you ready?
Yeah.
Okay. So number one is I was born in South America. Okay. Wonder what country. Let's see. Okay, I'm going to agree that he's born in South America. I'm going to say, and then we have to guess what country, though. I'm going to say we have to guess what country. Gee, I don't know. I'm going to say Chile. Dev, what do you think?
Oh, I'm not too sure. Maybe Argentina.
Okay, well, hang on a second there, Hernando. Don't say anything yet. So those are that for that. Okay, the next question is I climbed the highest peak outside of the Himalaya. Okay, so now if he is truly from South America, the highest peak in South America is, I believe, it's Aconcagua in Argentina, which is we were actually at the base. I went to the base of Aconcagua.
Yeah.
So that's that's another good one. Another one here we have is I had a documentary film made about my life.
Ooh.
See, that's cool too, because we all know Chip Duncan, who's a documentary filmmaker. We're mutual friends. So that's possible too. And then I'm going to throw in a last one here. I have met Aung San Suu Kyi in Myanmar, Burma in 2009 while she was under 15 years house arrest.
Oh, wild.
And we actually stood outside her house there in Rangoon. Yeah, remember? Okay, Dev. So what do you think? I was born in South America.
Man, those are all so good.
Climbed the highest mountain peak outside of the Himalaya. Documentary film made about myself, or Aung San Suu Kyi in Myanmar, Burma.
Maybe it's a little play. Maybe it's like he has climbed one of the highest peaks in the Himalayas. I don't know.
Right.
I'm gonna go with something like that. There's a little play there.
Yeah.
Yeah.
Let's see. I'm gonna say, oh man. I'm gonna say the highest peak outside the Himalaya as well.
All right.
So yeah, okay. Hernando, you're on stage.
So you're suggesting that that's the falsehood?
I'm saying that's the false one. Yeah.
Yeah, close. Well, it was a little cheating because they're near truths to two of those four, but the other two are true. So I was born in Bogota, Colombia.
In Colombia. Okay.
There's a truth there.
Right.
And then I am a climber, and I did indeed climb Aconcagua with friends. You're right. That's the highest. It's 20. It's not quite an 8,000 meter. All the 8,000 meters are in the Himalaya range, but it's what is it, 23,000 or something?
Yeah, it's pretty. Yeah, so it's pretty darn high. Yeah.
Chip has talked about making a film of me, but it has not yet actually got made. So, so that is a falsehood at the moment. And I did go to Myanmar in 2009 actually, but we did not meet Aung San Suu Kyi though. So that one's actually not true.
Yeah, that's funny because we we were there. We were in Myanmar in 2014, 2015, and we went outside her house where she was held before, because I think had been released by then. Or maybe not. I can't remember. Yeah, interesting, with all the gates and everything and all the writing all over. It was crazy. And now, it's unfortunate because Myanmar's kind of gone, taking a left turn. It's gone kind of back to the way, before, and she's back incarcerated again. And then but we do, it's incredible because we do have this mutual friend, Chip Duncan, who's amazing, an amazing guy and an amazing documentary filmmaker. And if anybody here listening gets a chance to check out, or definitely have to check out one of his films, he's done so many films, but it's called Duncan Entertainment. I'm going to plug Chip because he's such a great guy. And Hernando and Devin and myself, we've done journeys into Peru and then to Kenya and Ethiopia, etc. with Chip. So it's fantastic. And actually, Devin, I think you were down there and you trekked up to the glacier, right? Because Chip was filming something on climate change.
Yeah, it was like called the Salcantay. Or no, it wasn't the Salcantay. Sorry, no. What was it?
Yeah, you did the Salcantay before.
I can't remember what it was called.
Yeah, you went to the ceremony.
It was a crazy ceremony. It was like this huge coming of age type ceremony thing, and when we get there and we're like, what's going on? We hear like tons of like whips cracking. I'm like, well, what's going on there? So like all the young men like basically duel with like whips. And all the young ladies like dance all like the same time, and they dance and they spin and they do all these things while the young guys are just like whipping each other, like with like bull whips, like cracking whips at each other, boom, 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 smacking each other in the legs. Yeah, it's quite the thing. But it was definitely it was quite a beautiful ceremony. It was cool.
Yeah, and I think Chip was filming the receding, glaciers there, right?
Yeah.
I think that's what's going on. And then Hernando. So Hernando, you've been involved in a lot of kind of international, I guess, responses to, and also because of climate change. Hey, that's right? So you've been around the globe and involved in various disasters.
Absolutely.
Right? Yeah.
Emergency medicine is a relatively useful specialty in the disaster response and also health setting. And I think one of the flagships of my career is I've always looked to apply my medical skills outside of the four walls of a hospital. So I've done a lot of expedition medicine. I've done a lot of disaster relief domestically, and then transitioned to do it internationally. And the international disaster response also turned into other global health work around capacity building programs. Because disaster response is more about, sort of like the firefighters running into a burning building, put out the fire, and you turn around and go home, and those that are left can recover. But a lot of global health work is more long-term sustained capacity building, building up health infrastructures and things like that. So that both of those are global health, but in different focuses. I've gotten a chance to do a fair amount of that for the last 20 years.
Yeah. So I guess what we can do is we'll start here with, so let's talk a little bit about domestic and then work our way out towards international. So I guess currently we're all dealing with a national or international health issue here with COVID, and you're quite involved in COVID response in California. Is that correct?
Yes. So I say the day job is in California as an emergency physician, and that has included the Sacramento County EMS medical work I do, and I'm fairly involved at the state level. And I just think because of the background I have in hospital or healthcare emergency management and disaster response, I got pulled into the COVID response. And, I think this has been, as you all know, we've been living through this for 2, now moving on 3 years. And so it's, when we think of disasters, you think of a bomb going off or an earthquake or something like that, and something that's kind of happened suddenly and is over in a couple of days, a couple of weeks. But this pandemic is very much a disaster in terms of the impact it's had on society, economically, workforces, and certainly healthcare. The number of people have gotten sick and have died and things like that. So I've been working with the state California Public Health Department and the state level EMS Authority. And we've been trying to support the health system in California. First of all, anticipate looking at our numbers, looking at our modeling, see how our census in the hospitals is growing, how many COVID patients we have, and then working with the public health, because it's a balance between, right, we call them NPIs, non-pharmaceutical interventions, right, masking,
Yes.
for social distancing, closing sectors. At one point, we went to stay at home, a mandate, a public health mandate to try and decrease transmission and flatten the curve, if you remember that.
That's right. Flatten the curve.
Concept.
I remember that. Yeah.
Right, because what we don't want to do is exceed our healthcare capacity and excessively fill up our hospitals, right? Because that's when you get unnecessary if you don't have an ICU bed for a patient that needs it. So all of the interventions for public health and social messaging is around trying to keep the hospitals from getting overfull and protecting the most vulnerable, right? Making sure we get vaccines to the elderly and to the people with multiple medical problems and things like that. So I've been part of that effort in California for the last couple of years. It's been busy.
Yeah, it's been very busy, very busy. We see, it's like now we're sitting in getting closer to the end of or mid January 2022, and like you said, it's been 2 years, and it feels that the hospitals are they bursting at the seams again with this Omicron, or it seems to be, that's what they're saying up here. We're up in Vancouver, British Columbia, and it seems to be the sirens starting to go off a little bit here, that our hospitals are really starting to fill up again. Is that the same what's going on in California?
Absolutely. And around the world, and certainly in almost all of the states in the US, we're seeing the same surge words. And that's Omicron is an interesting variant. And the good thing about it is it seems to cause less severe illness and fewer people needing hospitalization. But the problem is that it is so infectious that the total numbers of cases we're seeing are through the roof. Right. So even if it's a third less virulent, it makes people less sick. If it's exploding at twice the rate the previous variants did, you still get people in hospitalization and die from it. So so it's still a bit of a challenge for sure.
Yeah. So with this, I mean, I guess with Omicron here, this is the latest variant to come through. What do you think? How do you think this is going to play out? I've heard that, like you said, it's much more contagious, but may not be as lethal as the previous ones. And so many people are getting it. It's almost like hopefully they're looking at like next week. This is what I've heard anyway, that hopefully we see the numbers maybe start to drop a little bit. I don't know if that's what's on your radar down there, but that's what we've been hearing up here.
That's more the consensus. And if we follow what Omicron has done in other places in the world, in South Africa and in the UK, where it bumped before in the US, it seemed to trail off for about many weeks and trail off fairly quickly. Although we don't know, again, there's no guarantees we'll see the same fall off. We may have a longer tail and more run out and more. But we're starting to see signs that perhaps the increase is slowing down,
right?
Which may be a good sign that within a couple of weeks we're going to start to see a flattening, maybe even a drop. So fingers crossed, because our hospitals are pretty full all over the country right now, and it's a huge challenge.
Yeah.
And the other factor in this, I think anyone can sprint for 100 yards, but to do a marathon really is hard for anybody, right? And so the challenge here is that the healthcare workforce has been very beat up, and I think healthcare, they were heroes at first. I think now they've just worked 2 years of long hours. In the US, we had some estimates that 20% of healthcare workers have already left the profession. And so we'll have tremendous staffing shortages around the country, but the people that are left are working very hard. So appreciate and be grateful for the healthcare work in your life.
Exactly. Yeah. Thank you. I mean, it's just, nobody could ever imagine of it, it was actually going to go on, this long. So I know it's like throwing something at the wall here, but how's your feeling on how this whole thing's going to play out? I mean, is another variant going to come through in 3 weeks? And if it is the chances, is it going to be like Omicron, slightly weaker and fizzle out, hopefully? Or are we going to get slammed like something, Ebola or something crazy like that,
I mean, we have centuries long experience in public health and with infectious disease outbreaks.
Yeah.
So for those that are in the field, there's a tremendous historical record of pandemics in the past and what they've done. So it is a challenge to predict. Like
Yeah.
we didn't see Omicron coming. We don't know if there's going to be another variant like that causes yet a fourth surge somewhere in the globe. But I think this is showing itself to be similar to other pandemics in the sense that variants that cause surges or bumps tend to be less virulent as time goes on.
Right.
We tend to develop that herd immunity either through prior infection or vaccination in the case of modern science, where we get more people that are protected. And there's a lot of conversation, even when we're dealing with Omicron right now, there's also a lot of conversation about how does this look as it transition from pandemic to endemic, right? That like seasonal flu, like we don't think it'll ever go away, right? HIV hasn't gone away, HIV is still around, but we have effective treatments, we have prevention measures, those kinds of things. So same thing with COVID, right? We have some better therapeutics, the vaccines work, and over time it's never going to go away completely, but it'll become endemic. So we'll see less of these very large numbers of outbreaks.
Right.
And who knows? Hopefully, this is the last variant that causes such an upheaval in the world.
Yeah, hopefully. My goodness, I know. So then I guess we could talk about COVID all day, and I think that was really very interesting there what you just had to say. So you've also been involved in a lot of like domestic in the United States, domestic disaster response developments with FEMA, and so would that be like a Katrina, like hurricanes and things like that? Would be
exactly?
Yeah.
Yeah, so it's part of my work domestically has been part of our national urban search and rescue system.
Okay.
And you're correct. So when disasters happen, usually disasters generally defined as something that exceeds the available resources.
Right.
And when that happens at local level, sometimes you have to go up and ask your governor for help. And sometimes it stays as a quotes local state disaster. But when something's big enough, even a state needs help, they'll go up to the federal level and ask federal declaration of disaster. So that's when FEMA gets involved. And as Hurricane Katrina, you mentioned, when that hit New Orleans, and we the only time we evacuated a major city in North America, right? We evacuated the entire city. So obviously a national level disaster, that the World Trade Center and the Pentagon during 9/11, and then many hurricanes in the Southeast, and things like that. So I've been part of that system since '95. Actually, the first one I went to was the Oklahoma City bombing.
Oh my gosh.
In
Yeah.
And many hurricanes to the Southeast. So some of these are, man-made, like a terrorist event, but many of them are natural, like hurricanes, which you mentioned, climate change and global warming. I mean, we're seeing much worse hurricane amounts of rainfall and throughout the South, and the wildland fires in California are very much related to climate change, drought that we've had in Western states, and the massive amounts of wildfires that we've seen in the West.
Yeah. I mean, it seems that, every time you turn on the news in, I don't know if it'd be like, used to be maybe August, September, you'd see the hurricanes coming in, rolling in through Florida and whatnot. And now it's like, you see them like in May and June or whatever. It's just, it gets earlier and earlier and bigger and greater every year. And then, in the Caribbean and Cuba, and everybody seems to be getting just pummeled constantly. And also, tornadoes, we never had tornadoes in Canada. now we're getting tornadoes in Canada. We had one here out at Vancouver Airport. It was a giant water spout a few months ago. Never had that.
Right.
And even here, in the past, we have in the Pacific Northwest, so Seattle, or Portland, Seattle, Vancouver, we're getting these things called atmospheric rivers, which are coming in and they're lasting for about a week to 10 days, and they're dumping extraordinary amounts of rain on us, and the flooding that we've been having. And now we had very, very, like the past few weeks, we've had extreme cold. Like we're talking about in Vancouver, we would maybe get 3 days a year, we'd get maybe below 0 centigrade. Where now we're getting -14 for 15 days at a time, and then massive amounts of snow, and then it all just melted. And in our house, we were getting flooding down here, and we had flooding out in the valley here, where people lost all of their farms, and it's never happened.
Yeah.
So you see this. So when you're traveling, you do a lot of international work too. So we don't hear about it as much in North America. We hear about our hurricanes in California, in New Orleans and whatnot, but we don't hear what goes on in Kenya and the Ethiopias of the world, which you've been involved in a fair amount over the years too, right?
Yeah, absolutely. I started doing the international response, I think, in around 2005, and
Right.
And that's been through various organizations, Doctors Without Borders and Relief International, International Medical Corps, Project Hope, a bunch. There's dozens of medical aid organizations that do work internationally and do healthcare. And the international work has been fascinating because the climate scientists, right? The conversation changed from global warming really to climate change because,
yes,
as you mentioned, the changes we've set off in the climate because of the extremely high levels of carbon dioxide and other warming gases, really, they've created incredible extremes of temperature variation. So not only are we seeing more moisture in the atmosphere because of the warmer temperatures and more rainfall in these atmospheric rifts, but you're also seeing other extremes of cold as well in certain areas and drought in many areas. And you're right, this is global. It's not just in North America. So impact climate change has had on the world is tremendous. And one of the things that I talk about and I've seen is that its impact is greatest on the poorer sector of the world, right? So the craziness of this is that it's the wealthier, more industrial nations that have been mostly responsible for climate change. The United States, China, European countries,
Canada.
The countries most impacted have been those with the poorer populations, that Bangladesh, that's at or below sea level.
I know.
Many African countries that have suffered tremendously from the drought that climate change caused, and the food insecurity and scarcity that has happened around the globe. So I think one of the things I've seen is that those negative impacts, I think the World Health Organization has already estimated that somewhere around 70 million people have been displaced from their homes because of climate change, right?
Exactly.
Or things like that.
Yeah. I mean, I think so. Moving into the future here, just watching what's been going on with the massive migration of people around the world. People desperately leaving places in Africa and heading to Europe, desperately leaving parts of Central and South America and moving north. I think I don't know, just watching from 30,000 feet looking down on our planet, I just see that over the next 20 years, one of the largest problems that we're going to have to deal with is people like migration, massive migrations of people because of climate change, having to move north or south, whichever, into a place that is more hospitable for humans to be able to live. And I just and then also because of that, people's health and safety and again, things like the COVID, these viruses popping up. You've got these people and it's I don't know, it just seems that there's a lot of it's getting kind of crazy.
Right. There's a component of climate change also that's changing the demographics around infectious diseases, for sure.
Yes, sure.
I lecture on the health effects of climate change some, and one of the things that I've seen in my research too is like Lyme disease, for example, in the Northeast. I mean, if you look at Lyme disease 15 years ago and 10 years ago and 5 years ago, it's just spreading so many more cases involving some more of the Northeast, and now, in Michigan and Wisconsin and all these other places, just because of the warmer temperatures and the mosquitoes and that transmit the illness and things like that. Same thing in malaria in Africa. So yeah, climate change is definitely affecting health and infectious disease for sure.
Yeah, I know we have things showing up here too in the Pacific Northwest, like you said, like Lyme disease. There's people that have Lyme, like what? It's not normal, for this far north. There's all these things are starting to move up. Yeah, it's crazy.
Yeah, I mean, there's an inevitability of it. I think I hate to get into sort of a doomsday type of conversation. I think the world has changed. It's always changed. I mean,
Always
if
changing.
you look at how many years the world has been at peace, it's shockingly small that there's always been a war somewhere here or there,
Exactly.
whatever else. I think though it's a good opportunity to be introspective and say, okay, what are we as a society, as a species doing to our planet, and can we be more mindful about and intentional about the way we live, right? Realize the impact that we have as a species, and then we have as individuals, and tread a path or footsteps that are consistent with our moral values around the world, right?
Yeah. No, it's exactly exactly it. Hey, Dev, did you have a question there?
Yeah, actually, yeah,
Yeah.
I was interested, like what set you down this path? Like, did you always want to be a doctor? Was that your drive in life?
Yeah, I think it's one of those boring stories, right? I think the average
think so.
American has 7 career changes, not job changes, but career changes. And for me, mine is that I've always wanted to be a doctor. I mean, I think different things reinforce that along the way. When when you're a 3-year-old, you want to be a doctor or an astronaut or a firefighter. There's a subset, and that's done more mythical or fantastical kinds of things. But then I was good at sciences, and so that was reinforced in school. And then I wanted to do something where I was with people and help people, and so medicine again continues to be complementary with that kind of goal. So the idea was working with people in a made a positive difference in their life, and I've been able to expand on that in medicine. And I love to travel and explore, and the global work factors into that. So as I mentioned, the idea of using the medical skills outside the 4 walls of the emergency department and just being curious about life.
Right.
Yeah, I think you're a bit of an anomaly too. I mean, fantastic to be a medical doctor, but to be able to kind of take that step and that leap and head to some of these countries around the world and into some of these disaster responses. I mean, you're a very unique fellow, and it's fantastic. And and I know you like to travel, but it was just, what was your first international deployment? Do you remember where you went
Well,
to help out?
before deployment, so the interesting, I think one of the things that grabbed me and made me interested in this work is, as a medical student,
Yeah.
I signed up and did a rotation in New Delhi, India. And so I went as a medical student just to learn, to do a rotation for 2 months. And it's the first time I'd ever been in a developing country. And it was really an amazing experience to realize how different and how similar people were. Because I think there's two, as you can imagine, even just from watching movies and news, with that life in New Delhi and healthcare in New Delhi, and the poverty is very different from anything we experience in the United States. On the other hand, one of the wonderful things about this travel that I enjoy to this day, and I remember from that experience, is that as humans, even though they have such vastly different experiences, like growing up in New Delhi versus growing up in New York City or Los Angeles or Milwaukee, is that people are similar, right? They still want to shelter for their families. They still want to be able to provide for their kids. They want security. So I think the human condition has some commonalities around the world. And it was just a tremendous experience to spend those 2 months in India as a medical student. So I would say that was the first full international experience I had.
Yeah, it's interesting that you said that, because I think, for me as well, I've been so fortunate to travel because of my work. I'm in emergency response to oil spill disaster stuff on the oceans. and a lot for work, and then a lot for pleasure, and a lot with the family. And the most amazing part is, people say, what's your favorite place? What's your favorite place that you went to? And I just kind of go, oh my gosh, like I can't even, they're all incredible. And the place that I always think that the place that we go is always a backdrop for the people that we meet, because we meet so many incredible people doing amazing things, and extremely hospitable, and extremely willing to help, and extremely caring in every single country that we've been to. I mean, it could be from Myanmar to Bhutan, wherever, in the Middle East, from Kuwait to Iran. Everybody, like you said, everybody is caring, everybody cares about the family, and everybody wants to help out and make our world a better place in some way. We get some of the wacky governments, things that, kind of screw things up, but the people of these countries that are going through, a lot of hardship, they're incredible, incredible, strong, caring people, just like the whole planet. So yeah, very, very. It's we've actually been blessed, because we've been able to travel like yourself and meet incredible people, and spend time with people like Chip Duncan, and see the world through different eyes, as opposed to being a tourist, but actually you're on a journey, and you're meeting the real people, and you're getting involved in some of these causes and things. So so thanks so much for everything that you're doing. Dev, do you have one final question there?
Yeah, I actually do. Yeah, Fernando? I got one final question for you here. I was just wondering, so what are, let's say, 1 to 3 points of wisdom that you've acquired over the years that you would share with, let's say, the teenage version of yourself, who is like, trying to figure out his career, and what do I do, and I want to be a doctor? Or what would be your 3 points of wisdom that you would share?
That's a good one.
Put you on a spot there.
Well, I always think to be a paraphrase of Mahatma Gandhi, who said, it doesn't matter what you do, it just matters that you do it. And I would say, find what inspires you, and find a way to make that part of your life, and find a way to make a positive difference in the world. Wow. Right? I mean, not everyone has to be a doctor. Like I told my kids, I don't care if you sell hot dogs on the street corner, just do it well, and make people happy doing it. And so I think that's the way. Is one of those pearls is find a way to make a positive difference in the world. I think another one is that what I mentioned already is sort of that commonality of all humans on this planet, right? I think there's so much divisiveness and us versus them, and tribalism and nationalism, and it just I think if we're going to survive as a species, we have to do it together, right? And I think benefit of the doubt in finding the commonality with people, and sort of being more a cup is half full than a cup is half empty view and perspective of the world.
Yeah, well, I think you're right. It's the commonality, and I think over the past couple of years we've locked ourselves, we've been locked away, and we haven't had as much contact with people across the street, people with different types of opinions. So we've been locked away, and we've been looking at our phone and what's coming in, and we've been bombarded. So you're talking about tribalism. It's being locked away and looking at your phone or your TV all day can create this tribalism, and it's it's just it'll just be so nice to be able to go out and greet our neighbors and meet people from around the world, and kind of reconnect the human species again, and to realize that we're all the same, like we were talking about before. We're all the same. It doesn't matter where we're from, Afghanistan or wherever. We're all the same, and we're all have the same values. So it'll just be so nice. And because you're right, the little bit of this tribalism is starting to kind of come up through the cracks, and that's probably not a great thing. And so just to be able to go and reconnect with fellow humans moving forward will that's probably one of the best medicines we could wish on humanity right now, is to be able to go and reconnect with everybody.
Absolutely.
Yeah.
Sure.
Yeah. So thanks, Hernando. We really, really appreciate you being on our show here. And I'd love to do a journey with you one of these days. Chip keeps talking about it. So, I'm sure that'll happen. That would be really amazing. So yeah.
That would be great. I would love it. Absolutely.
Yeah.
Well, thank you very much for having me and for taking the time to chat. It's been a pleasure.
No, thank you so
us too.
much. Yeah.
Yeah, on that note, we're going to wrap it up, guys. Thank you so much for checking in today, checking it out. If you guys want to learn more about Dr. Hernando Garzon, we are going to put everything in the link in the description of the video so you won't miss a thing. Other than that, thank you so much again. Thank you so much for coming on. It was awesome talking to you, man.
Thanks, Hernando.
Thank you. Thank you.